But when I'm looking at the ICON study out of Florida and it excludes pregnant women, what do I say to my cousin who is pregnant? And that is an exclusion criteria that's used. When
I've
I'm
never
looking
heard
at,
of any trial with a pregnant woman in it.
but this is
When has
not, but
pregnant
this
women
is,
been in any
but
trial?
but this is, again, we're talking about giving ivermectin as a prophylactic, correct? So that means we're saying to people that we are going to say this is going to be safe for you to do. And yes, we have to do something. But the things that we can do as a population that would not make any risk to persons, regardless of their pre-existing condition, are the simple things of wearing masks, to wash our hands, to avoid these large crowds. And that has a better efficacy than any drug that we could ever do.
I haven't thought about ivermectin since medical school, and I know its use is primarily in treating various parasites, worms. I mean, Dr. Kory, when he says that billions have gotten this drug and it's safe, I mean, that's pretty compelling. Of course, there's a burden that you want to know everything you possibly can for the use of this medication in all different patient populations. But at the same time, people are dying. And for that reason, okay, maybe you're not going to give it to a young child. Maybe you're not going to give it to a pregnant woman. That's a different scenario. So I'm a little more open-minded. I understand 100%, Dr. Hilton. We need that information, but in the meantime, Dr. Kory presents a pretty compelling story for this drug. And, if I could just ask Dr. Kory, there is one question. We're hearing all these great things about ivermectin. There could be a concern that people might try to get their hands on the veterinary version of this drug, which is out there a lot because animals get these parasites. Obviously, you're going to advise against this.
Yeah, no, we can't advise to take the veterinary version. We don't have the safety data for that. No, what our whole goal here is to disseminate the knowledge of its unparalleled efficacy. It is going to be a major contributor to ending this pandemic. It's going to be another tool in the toolkit along with the vaccines. We think it's a bridge to the vaccines. We need our public healthcare leaders and agencies to provide the guidance, and they need to start ramping up and preparing because this drug will be proven. I want to make one last point. On these call for randomized controlled trials, you will harm patients if you keep doing more trials when we're sitting on this amount of evidence.
Dr. Hilton, Dr. Kory, Drew and I agree. We all four agree that we want to be able to find something that works and that it works for as many people as possible. So we hope both of you actually are correct and that it bears out for the subsets that haven't been tested and Dr. Kory for all those who have been tested. So thank you guys so much for a very spirited and important conversation.
I live, eat, and breathe this stuff. It's going to end the pandemic, guys. You heard it here first.